I would extend my gratitude to GBPN for inviting us and hosting us very nicely. We've also had a memorandum of understanding between VFC and GBPN. We would want to take this decision ahead in our net zero plan, as well as in all the building codes that which we followed. Of course, in the argument of conservation, regulatory framework is also required, wherein we wish to be guided by the international principles as well as the national priorities of the state. Whereas in case of the GBPN and VMC, we would want to take this decision ahead in all our planning, our policy, and in the further executions of our program.
I am afterthought Singh. I'm working as Chief Town Planner with Town Planning Department, Government of Haryana. So today's event was wonderful in a way that it started a new engagement with GBPN with the signing of MoU, and it broadly involves three areas. One is how do we make implementation incorporate ECBC and ENS as a digital platform into the online building plan approval systems? How do we propagate building guidelines within the statutory framework that we follow? And how do we formulate the urban planning, healthy urban planning guidelines, which can be implemented within the state of Haryana? So that's the broad framework for our MoU. And to that extent, today's discussion on those issues were quite constructive. A very wide range of professionals were available.
Today's event, we have signed two MoUs, one with the Haryana Town Planning Authorities and the other one with Vadodara Municipal Corporation. These two MoUs create a shift in how we are looking at urban planning and health. The key takeaways from today's event and the roundtable is that a huge amount of intervention needs to be brought into urban planning, and how we are looking at urbanization. The how of urbanization has to be really relooked in terms of human health and its economic impact.
I think this was a very good event, and the action lies at the city level. So working with city and understanding city's challenges and integrating. And at the end of the day, how do you integrate urban with health is what matters. And whatever we talk about, plan, action plan, end of the day, our major focus has to be that citizen feel comfortable, citizen feel that we provide livable cities. And I think GBPN is doing a good work towards this direction.
Well, I think it was a very successful event today. And it was wonderful to hear from Commissioner of Vadodara. One thing that got established in my mind at least was that there is a definite connection between urban planning, urban management and municipal services that produces healthy outcomes. And we are all aware of that. And our task now is to work with the city of Vadodara, develop a plan with them and see its operation over a period of time, and learn from that.
One very timely discussion. A very significant takeaway for me really is the affirmation of the health and nature connection, which I think while there was a lot of discussion on the decarbonization and the waste and the pollution and the energy space, we did get to it in the end. And the fact that spatial planning and spatial governance, I think very important, city planning, city governance and health cannot be disconnected from the kind of urban nature that we are looking to encourage, nurture, develop, or conserve and rebuild almost, and how people can be connected better. Communities, people, citizens of all economic strata, which will ultimately have very positive health impacts. So I think that is something that I really take away and needs to be worked upon much more. I think there's a lot of information we have, research that we have, but we haven't brought it into the urban planning space as yet, which means that's very good. Thank you.